Over the last few years, there's been a really profound awareness of drugs, especially drugs in the medical benefit. But what is still kind of emerging is having a wide understanding of what is really in the medical benefit. What does the medical benefit mean? So there's really not one medical benefit. There's a collection of different benefits that ultimately all roll up into one thing called the medical benefit. So if you need to look at the different places of service where you can receive a drug that's covered in the medical benefit. You can receive a drug in the physician's office, you can receive a drug in the outpatient hospital, you can receive a drug at an infusion suite or in your own home through one of our home infusion nurses. It's critical to understand that distinction because the contractual methodologies and the cost differences between those three sites of service are dramatically different. The biggest difference is the outpatient site of service, the way they're paid and the way they're reimbursed for drug therapy as opposed to physician offices and home infusion and specialty pharmacies typically results in the hospital being anywhere from 20 to over 200% more expensive for the same therapy delivered at the other sites of service. And you'll see a wide variation across different hospitals what they're being reimbursed for the same drug. So what site of care optimization does is recognize that variation in cost at the hospital, knowing that the drugs can almost in the overwhelming majority of instances be provided at a lower cost at an alternate treatment site, whether it be the physician's office, home infusion, or infusion suite. Educate those first to set your benefit design to make sure that you're encouraging the patients to use the most cost-effective site of service. And then once that's in place, educating the utilizing patients who are receiving those infusions in the higher cost sites of care and making sure that they understand what their benefits are, how they can transition to a different site of service, and the ultimate cost savings that they would directly benefit from. So what's really driving the site of care is the awareness is growing. People are now starting to ask those more deeper questions and understanding the dynamics of the different places of service. And it's a very effective way to maintain access to medication. You're not telling anybody they can't have their drug. What you're stating is your cost will vary depending on where you go to get that drug, and plans are changing their benefit design to make sure that the patient has some kind of skin in the game, if you will, with respect to their location that they choose for their administration.